welcome to Health Talk for Pikeville Medical Center. I'm Jill Fraley-Dotson. Today our guest on Health Talk, Dr. Fadi Alacross, Medical Director of Infectious Disease and Control at Pikeville Medical Center. Also, Chief of Staff, Dr. Fadi. Always a pleasure to have you.
My pleasure.
We are going to talk about something today that we're hearing a lot about on the news and in our surrounding communities, not necessarily in our community as much, but certainly our surrounding areas. And that is hepatitis A. We hear a lot about different forms of hepatitis. Hep C is something we've talked about on previous shows, but hepatitis A is something we're hearing a lot about. So today's show is going to help inform the public and to help us to understand a little bit better what this particular disease is. I want to let you start a little bit and tell us what is hepatitis A and how is it spread?
I want to explain to the public, as you mentioned earlier, we have several types of viral hepatitis. We have the A, B, and C, the most common ones. And I think the problem that we're facing now in the state of Kentucky that we're experiencing in hepatitis A outbreak. And if you look at the number here in the state of Kentucky, that we have up to May, like probably 2 days ago, 448 cases of acute hepatitis A. We have 315 hospitalizations, which is definitely a high number for the state of Kentucky. Usually we see 20 cases a year. Currently we see a bunch of cases, and the number definitely is very, very large. At this point, this outbreak resulted in 4 cases of deaths, okay, which is definitely, this is worrisome for us because we don't know exactly how much this outbreak can cause mortality. And several cases in the state of Kentucky matches the genotype of hepatitis A in ongoing outbreaks in California and Utah. So we have several commonality between these outbreaks between multiple states in the United States. So at this point, we don't know exactly what's the origin of these cases. What we believe it's most likely coming from drug use and from sexual activities. I believe so. At this point, Louisville is the epicenter of this outbreak, and especially Jefferson County. We're talking about over 100 cases.
Wow.
So unfortunately.
Yeah, locally I think there have been a couple of cases in Boyd County around the Ashland area, but certainly nothing like what we're seeing in Jefferson County. We want to make sure that we do everything we can to prevent, but I do want to ask you, what exactly is hepatitis A?
So hepatitis A is a virus, we call the RNA virus, and this virus will cause severe liver injury. We call it inflammation of the liver, or we call it hepatitis. The problem with hepatitis A is highly contagious. And if we go about the definition, how to define that infection, you need to have symptoms caused by the hepatitis, plus you have to have a confirmation. And this confirmation could be either you turning yellow, your eyes or your skin, we call it jaundice, and you have a test that shows that hepatitis A antibody is positive or increase in the liver enzymes. So this is basically how you define hepatitis A.
You mentioned that it's highly contagious. So what can I do? How can I contract it? How is it affecting us?
There are several ways to contract hepatitis A, but the main one is what's called oral fecal route, which means contamination of the food and water from people who handle food and water and didn't wash their hands. So going back to the origin of that problem, if you wash your hands carefully, you keep them clean, this is definitely will prevent this epidemic from happening. So again, one more time, I emphasize all food handlers at this point to wash their hands very carefully to prevent the problem from getting worse. So number one, at this point also we have seen tremendous increase in cases coming from other sources, from sexual activities, mainly with homosexual people, men having sex with men, and also with heterosexual people. We've seen also problem going with homeless now. So homeless IV drug users seems to be a cause of passing hepatitis A. And also we have seen many cases in jail. So inmates are currently contracting hepatitis A. I don't know why, probably because abusing drugs also in jail. This could be a possibility. But unfortunately, we have several ways of passing hepatitis A other just from oral fecal route.
How long does it take for the disease to manifest?
Okay, usually this is what we call it incubation period. So if you get in touch with somebody infected, you need 2 to 3 weeks to be able to pass the infection. So after 2 to 3 weeks, you may have the symptoms, but this is what's called incubation period.
Clinical manifestations of HIV. Let's talk about that.
So what people basically they will have if they contract the infection, it could be like broad. So these people, they can have what's called flu-like symptoms. They can have muscle ache, joint problem. most of these people, they will have some abdominal ache, they have some nausea, and majority of them, especially in adult, they can turn yellow. Okay, so these people, they have other clinical manifestations such as swollen lymph nodes, they can have skin rashes, they can have like some weird symptoms, but in general, abdominal pain, nausea, vomiting, diarrhea, and flu-like symptoms.
What about the management?
Okay.
Is there any specific treatment?
The good thing about hepatitis A, it's not fatal, which means the mortality rate from contracting hepatitis A is so low. We're talking about 0.06%. And majority of these people, they have what's called self-cleaning or self-clearance of the infection. It may take up to 2 weeks to 3 weeks. Some people, they take up to 2 months to be able to recover from the infection in the majority of cases. Like minority of these patients, 10 to 15% can have symptoms up to 6 months. But usually there's no specific treatment for these infections. But what I emphasize on the importance of rest, you need to calm your body. You need to take plenty of nap. Like you have to get rest. On the top of that, you need to drink plenty of fluid. Some people, we need to ask them to drink plenty of fluid. Some people, they have to go to the hospital to take IV fluid for that. Sometimes we give them medication to calm the nausea and to control the diarrhea. But in general, there is no specific treatment for hepatitis A. But what I ask people to not do during these outbreaks, if you have hepatitis A, do not try to drink alcohol, because alcohol definitely will add up on the stress on the liver and make the condition worse. So please do not drink alcohol when you have hepatitis A or any inflammatory process of the liver, because this is definitely will make it worse.
So let's talk about the prevention of HIV. How we prevent it. There's a vaccine. Not only is the washing of our hands so important, but there's a vaccine that we need to tell people about.
Definitely. So this disease, the good thing about it is preventable by vaccine. There's definitely vaccination for this. I'm going to talk later on about that. But there are several other ways that can help to prevent this problem from happening. And the first one is careful hand washing. So if you clean your hand carefully, mainly with soap and water, this is going to be a very effective way against hepatitis A. So frequent hand washing is crucial in controlling this outbreak. So I definitely recommend everybody, especially food handlers, when you go to restroom, please clean your hand very carefully, because we don't want to contaminate this food. The other way also to prevent that problem is by keeping toilets and bathroom clean. So I need somebody in these areas, they need to keep watching the bathroom and the toilets. We need also appropriate handling and cooking of the food, so you need to do it the right way. So I want to also emphasize on one thing. Some people, they think if you freeze the food, this is going to help to prevent hepatitis A. Unfortunately, this is not a good way to inactivate the hepatitis A. So definitely this is a myth. Do not freeze the food to prevent hepatitis A outbreak. There are also
sanitizers, though. I want to mention that really quickly because I think we all like to keep hand sanitizers. That is not the way to prevent it.
It's a good way, but this is not the perfect fashion to clean all the germs from the hand. Definitely, I'm an old-fashioned guy. I like these, especially these food handlers, to wash their hand very carefully with soap and water. They need to rub very well. They need to say happy birthday. Yeah. So they need to take the time to clean their hands to prevent the problem.
My favorite cleaner is bleach.
Oh, I agree with you.
And that is the best way, especially your household surfaces, is to use components of bleach.
But I believe that your hands do not like that. But
no,
unfortunately, this is a very effective method to clean the hepatitis A and other germs, especially on the surfaces. So what I recommend people, if you want to clean very well, try to use the bleach and try basically to prepare it 1 to 100 dilution of household bleach to water and clean these surfaces. This is going to be a very effective way to clean and to wipe all the germs from these surfaces.
Now, can it be transmitted from a municipal water supply?
And this is a good question, because I got a lot of questions about, can we get it from water, from the tap water? If we do some water activity, can we catch that? Okay, I want to say clearly that transmission of hepatitis A from exposure to contaminated water in the United States is considered rare. And this is definitely related to adequate chlorination of water. And this is definitely will kill hepatitis A that enters municipal water supply. So definitely the chlorination is going to be a very helpful way to prevent this hepatitis A from reaching our water. So I believe at this point, I shouldn't be worried about that water. So I shouldn't be worried about water activities, because I think we're doing appropriate methods to clean our water.
Let's talk about the chronicness of this. Can it become chronic?
The good thing about hepatitis A, it will hit you acutely, which means all of a sudden, it takes it time to heal. And once it heals, this will provide you immunity for the rest of your life. So the good thing about also hepatitis A is not like hepatitis B or hepatitis C, when that insult can stay chronic in your body, and that hepatitis will lead what's called to cirrhosis or chronic liver damage. So hepatitis A doesn't cause that. It hits you one time, and once you're immune to it, that's it, it's over. So there is no concern about chronic inflammation of the liver from hepatitis A.
But can you become reinfected with the disease?
There's very rare to be reinfected from that. There is no way. Once you build immunity from hepatitis A, you cannot get reinfected from it, because that immunity will protect you for the rest of your life.
There is a vaccine that we do want to discuss. Hepatitis A is a vaccine preventable illness. Let's talk about it.
Definitely. That's a good thing about it, and that's why I encourage a lot of people to get vaccinated for hepatitis A. At this point, the Kentucky State will encourage, not encourage, this is a requirement, that all students in kindergarten up to grade 12 are required to have 2 doses of vaccination with hepatitis A before the next school year starts. We've been doing it for many years. So this is definitely very helpful to prevent that infection in our kids. On the top of that, vaccination is encouraged and recommended in all high-risk population. And I'm going to talk about it later on. And mainly homeless people, people abusing drugs, okay, and especially men having sex with men. So these are the population at high risk to contract hepatitis A and pass it from one to another one.
The Kentucky Health Department recommends hepatitis A vaccinations for everyone in the counties that are currently affected, and I know that you agree with that.
Definitely, I agree with that big time, and definitely the requirement now to give everybody in these counties, mainly Jefferson. We have over 115 cases in Jefferson now, and unfortunately this is very sad. We have in other counties that you can look at the screen, like we have Bullitt, Hardin, Greenup, Carter, and Boyd counties are the main counties that are required now to vaccinate everybody.
Yeah. We want to reiterate those who are at highest risk, IV drug users, of course, homeless, and those people who have expected close personal contact with this, it can result up to 2 weeks after.
Correct. So this is basically the list of the highest risk people that can contract hepatitis A, and I'm going to go over like briefly. If you travel to somewhere else, especially outside the United States, but I don't know if I have to say outside the United States, because we have outbreak now in the state of Kentucky, Indiana, and other states. Right. So probably going to these states as well could be a risk factor to contract hepatitis A. So at this point, it's very hard for me to tell which area is safe from not contracting hepatitis A. So the main people at risk are people having sex with other men, homosexual people, people using illegal drug use in the needle, okay, in the vein or in the nose. So definitely these are going to be high-risk people to contract hepatitis A. People who are homeless, unfortunately, because lack of sanitation. Right. Okay, we're talking about people with chronic liver disease. I'm going to emphasize on that. If you have a problem with your liver, you cannot take the chance to have an hepatitis A, because this is definitely will be fulminant. So these people, I encourage them to check with their physician to see if they need to be vaccinated for hepatitis A, from preventing that problem from going any further. Okay. I already also asked people who are having problem with what's called blood disorder. They require blood product, to talk to their physician to see if they're required to get the vaccination. And I think these are the main people at risk to contract hepatitis A. But I'm going to go also to IDEA. We're having major problem here in the whole state of Kentucky. Are you willing to take the risk to catch hepatitis A? This is basically my first question. Is everybody required to get the vaccination for hepatitis A? So what about other departments? What about the police department? What about EMS? What about firefighter? What about sanitation workers? What about food service workers? Childcare staff, teachers. So what about these people? Okay, is there any recommendation to do universal vaccination? I think I'm a big fan of it, because this is probably the safest way to do it. However, at this point, there is no CDC requirement, okay, that mention about using universal vaccination. So hopefully we'll wait and see, and hopefully they come with this conclusion.
Let's talk about the vaccine series and how we administer that vaccine, especially for adults. Let's start there.
So we have especially for adults, which I'm going to talk today, we have 2 series of vaccination. You get the first vaccine at day number 1, and then you wait up to 6 months to get the second vaccination. I want to say something. These vaccination series are extremely effective. And basically, you can get almost 100% protection even from the first shot. So the better way is to take 2 shots. But if you miss one, you still have some protection. And the good news about these vaccinations, this will provide you immunity up to 20 years. So this is great. So if I get the vaccination, I'm going to get protection up to 2 years, 20 years. All the studies showed that antibodies, will stay in your system up to 20 years. So this is definitely a great way to prevent that problem from happening.
Let's talk about this. Pre-vaccination testing, should that be performed?
This is very debatable, especially in the United States. And all the time when I'm talking about having blood tests, I would like to basically weigh the cost of the test and the cost of the vaccination. And if you look at this slide, we can see basically the test can vary between $17 to $92. I'm talking about $62. And if you take vaccination, you can take it, if you go to health department, you can take it up to $60 for the whole series. So this is, we're talking about comparable price for both of them. So in my opinion, I believe that vaccination will be probably a better way instead of pre-testing these people, especially in the United States. This is not an area of high outbreak for the hepatitis A. We've never seen it before. So majority of these cases are new. I don't think that older people have been exposed to it, and subsequently vaccination will be probably a better way than testing for hepatitis A before we give the vaccination.
What about post-vaccination testing?
And I'm going to say something else, because we're dealing with the majority of our patients are high risk of drug users, unfortunately homeless. So are you taking the risk to do a needle stick on these people, get blood, and wait for the test to be negative or positive to make a decision for that? This is number one. Why we don't do it up front and vaccinate them? And I know this vaccine is very safe and doesn't have a lot of complication. So that's why, this is my opinion, I encourage everybody to be vaccinated. So check with your primary care physician and see if you're eligible for that. I think this is going to be a perfect way to protect that outbreak from happening.
Absolutely. With everyone talking about it in our communities, a wonderful opportunity today for us to explain exactly what it is, why there is such a need to get vaccinated, because it's always, as we say, better to be safe than sorry, right?
I agree with that.
Dr. Fadiala Cross, always a pleasure. Thank you for updating us today, and I look forward to discussing many more medical issues with you again in the future.
Thank you very much for having me today.
Thank you so much. This has been Health Talk for Pikeville Medical Center. I'm Jill Fraley Dodson.